Hello, my name is Eudora Parker, and my paper was on sexually transmitted diseases as it relates to teens and prevention for young adults. I focused on the statistics that were given today, what we need to equip these teens with, and what we need to do for the future. How do we need to guide the research? None of us likes to talk about this, much less with a teenager. But the CDC reports that 20 million new cases are reported every year. Half of those are between the ages of 15 and 24. That is a huge number. Also, the youth behavioral surveillance system that the CDC puts out has reported that 47% of our young people are sexually active. And of 15% of those 47 have 4 or more partners. That's a huge amount. So we need to equip these teenagers, with the knowledge that they need to know. And the CDC school health profile states that half the high schools and a fifth of the middle schools are equipped with what they actually need to teach these kids. So what do? We start at home. We start at home and we have that hard conversation. We push past our comfort zone and we talk to our kids about what it is to be sexually active and what the consequences are. We give them the information. We teach them what healthy relationships look like. We teach them, the correct way, if they are going to have sex, the correct way to use a condom and how to get condoms. Excuse me. We teach them on how the disease is transmitted. We teach them the importance of abstinence, but we also teach them that if they're going to have sex, to discuss it with a partner, to have that open communication, to ask those hard questions. We don't make them feel ashamed. We don't make them feel as though, they're horrible. We let them be comfortable to talk to us. Because if they're not going to talk to us, then this number is just going to increase. And then for the future, we need to get all these entities that are close to our kids, physicians, schools, parents, and we need to equip them with the knowledge that they need to know to impart to the teenagers. Teenagers are not just going to go out and seek this information. We've got to take that lead and be that one that steps forward and says, hey, if you're going to do this, this is what you need to know. So I feel that if we better equip those people that are talking to our teenagers, such as parents, physicians, schools, with the information they need to know and make them aware of how important it is for our teens, then we may better equip our teens with the knowledge they need. It's something that we need to talk about. We need to not be afraid, to have that conversation. We can no longer just pretend that it's not happening, So I feel that there needs to be more education to the parents, to the schools, to the physicians, and they need to take a step forward and, let's find out how many parents have that conversation. How equipped are our schools? How many physicians are open to talking to their teens, the teenage patients, about sex and sexually transmitted diseases? That's where our research probably needs to go. Thank you for listening. Have a good day.